my name is Pip. I am a physio at Sydney Advanced Physiotherapy in Lindfield. I'm going to show you my 5 favourite stretches for back pain. Now, before you try any of these stretches at home, it's really important to note that you should only feel a stretch where I tell you you should feel a stretch. You shouldn't feel pain, pins and needles, numbness, or anything other than what I describe. If you do, you need to stop straight away. I would strongly recommend that if you've had pain for more than 2 days, you go and see a physiotherapist to get help with your back pain. If you tend to be the type of person who your back goes every 6 months, every 12 months, that tends to be indicative that the underlying issue that caused the problem in the first place hasn't actually resolved. And again, I would suggest in that case that you go and see a physio. Lancelot is a hip flexor stretch. You should feel it in the thigh here. What I get people to do when they're first doing this stretch is do it against the wall, because then if they're wobbly, they can hold on. But also they get a bit of feedback if they're doing it incorrectly. So the most common error we see is that people drive their hips forward like this. So if you do that, you'll actually bang your knee into the wall. So that's a pretty good sign that things aren't going so well. What you want to do is make sure your knee is underneath your hip, your front leg is bent to 90, and then it's a Michael Jackson pelvic tuck. So you're tucking your bottom under without traveling forward. Tuck under, you should feel a stretch here. Hold for 20 to 30 seconds, and then repeat on the other side. Mermaid is another favorite of mine. It's one that you can easily do in your chair at work or sitting on the floor. What you do is you put one hand beside you on the floor, or you can hold onto the chair if you're doing it sitting. You've got to keep your bottom super glued down so you don't let it pop up as you lean. Up and over you reach, and then you should feel that down the side here. As you're holding that stretch, you want to try and breathe into this area and stretch it out a little bit more. And you hold that for about 5 seconds, and then you're off on the other side. If you have a roller, you can lie yourself on it, and you want to have your bottom at one end and your head at the other end, so you're entirely supported on the roller. Then what you can do is you can work yourself into different degrees of stretch. I quite like this angle, but I can get my hands on the floor comfortably there, and not everybody else can. When I'm in this position, I can feel a chest stretch, and that's all you should feel regardless of the angle that you're working on. So just find an angle that's challenging for you, but no pain, no pins and needles, no numbness. Don't do this if you're wobbling and you're going to fall off the log. Another easy stretch that will help your back is a glute stretch. So you can easily do this sitting down. All you've got to do is make sure you're in a comfortable chair, cross one leg over the other, and then gently put your hand on top just so it can't pop back up. You're not trying to push that down. Then, keeping your back straight, you're going to lean forward as far as you comfortably can, and you should feel a stretch in the glute on this side. Hold for 20 to 30 seconds and then perform the same stretch on the other side. Another great stretch to do for your back is a chair twist. It's a little bit harder in chairs like the one I'm sitting on because it's going to pivot a little bit when I'm doing it. So you need to make sure that your chair is not quite as mobile as this chair. So what you want to do is have one hand at the back of the chair, one hand on your knee, opposite knee, and then use that pressure on the hands to help you turn around a little bit. But you want to try and keep a straight back as you do that. Hold for 5 to 10 seconds and then off to the other side. So once again, I would like to drive home the fact that if you felt anything other than a simple stretch while you were doing these exercises where I told you you should feel a stretch, you need to stop doing them. You shouldn't feel any pain, no pins and needles, no numbness, nothing. I hope you found this video useful. If you have, please press share so that your friends get the benefit from the video as well. And if you have any questions, you can drop them in the comments below, or you can get in touch with us or book appointments via sydneyadvancedphysio.com.au or calling us on 9416 4410.